welcome back to Fertility Show Africa 2022. This is our day 2. I hope you enjoyed day 1 as much as I did. We learned so much yesterday from IVF, the decisions that you make from IVF, surrogacy, the law, how it impacts you. You know, we learned so much yesterday. I hope you learned just as much as I did. And thank you for joining yesterday and welcome back today. We're going to have just as much fun. There is such a great lineup for you today. And today I hope you join the yoga session to relax yourself. The guys that are online, welcome. If you still want to invite people, please tell them to go on talks.fertilityshow africa.com to join us online if they can't make their way here. Those that can make their way here, please tell them to come here. We've got a great lineup for them. This morning, we are starting off on a high note. We're starting with Dr. Kelly Owen. She's going to be talking about the invisible loss of a negative pregnancy result. Dr. Kelly Owen is a clinical psychologist who has been in private practice since 1996. Through her own journey with fertility difficulties, she started working in this field 15 years ago. Her specific interest is the severe impact that infertility has on the mental health of couples and individuals. Dr. Kelly Owens, please come join us and start the day for us.
Hello, everybody, and to all the people who are watching online. My talk is essentially about the grief of infertility, not just the grief of a negative test, but when we start the whole fertility journey, that's when the grieving process often starts. And it can be misinterpreted or misdiagnosed as depression, but very often, right at the beginning when we realize we're not falling pregnant, we've got issues that need medical attention, we start a grieving process. So in terms of what grief is, grief for me almost defies a definition. I've looked at all the definitions, and most people will know about Elizabeth Kubler-Ross, who was the grief expert, and she spoke about the stages of grief. And some very clever people modified her stages to 7 stages: to shock, denial, anger, bargaining, depression, testing, where you seeking realistic solutions, and then acceptance. And from the literature and from what people will know is that there's this expectation that grief happens in a specific way, and that you go through the stages and you come out at the other end, and then the grieving process is over. From my clinical experience and from my own personal experience, grief is not linear. You can go from one stage to the next, you can go back to shock, back to denial, back to anger. It doesn't happen in a nice linear fashion in the way that the textbooks tell us that grief happens. And I've had to spend a lot of time speaking to my own patients about the whole grieving process. And currently I've got a lot of patients who are still at the very early stages of the IVF infertility journey. And what struck me recently was that every time and it's on a 4-weekly basis, you are anticipating, am I pregnant, am I not pregnant? You're anticipating, you have a sense of anticipatory grief, but you also have been told you've got to be positive. With fertility, you must be positive, and you mustn't be negative. You must have happy thoughts. You must do all the things which we try and do. But when you get to that day where you start your period, and you're on the bathroom floor in tears because you are not pregnant, or you get that negative blood test when you've had embryo transfer, that is not depression. That is grief. That is the grief of the loss of your dream, of the potential family, of what you were hoping for. And that grieving process also affects you physically, mentally, emotionally. Often patients will say to me that they feel physically ill, like they feel they've got like flu symptoms, and that's part of the grieving journey. And with a negative pregnancy test, or when you start your period and you realize you're not pregnant, it's an invisible grief. You've got nothing to explain to people what you've lost. Often couples choose not to tell people or not to tell families about their fertility journey. That has its pros and cons. The difficulty there is that when you are grieving and you are stressed, you have nobody to share it with. Some couples find that if they do speak to family, there are too many questions, and they don't want to answer. They don't want to answer questions. They don't want to be inundated with, "Are you pregnant yet? Have you done another test? How's it going?" It becomes very difficult to navigate this. I want to call it a journey, but it's more. It's not quite a journey. It's like an uphill hike. In very unpleasant terrain. The invisible grief. How do you explain to somebody that you didn't fall pregnant and now you're grieving? People will say to you, "Oh, you can try again next month. You'll have another chance." But in that process, for them, they're okay, but you are still in this grieving cycle. So you also have to consider that the fathers involved here also grieve, and men are often very much neglected in this whole process. We forget that a negative pregnancy result, or when you start your period, that affects the dads as well, and they also go through grief. And for me, what's very important is that you get help, you have somebody to talk to, because what for me is paramount is that we protect the relationship, because fertility treatment and all the negative emotions and the ups and downs, this often causes a lot of friction and a lot of difficulties in relationships. In my own practice, and this is anecdotal, this is not anything in terms of what the research says, I'm telling you what I've experienced. Men will often hide their emotions. Women can be far more expressive, and women will mistake their husband's silence for not caring, and then you have marital distress, and that's, we want to protect the relationship. So the important thing is to get help. It doesn't have to be a psychologist. It can be anybody. It can be somebody, a pastoral person. It can be a friend. But get help and share your experience, because by that sharing, you dilute the pain, you dilute the grief, and it's a long journey. Some couples can take two years or more. I've got a couple now who have just fallen pregnant after 8 years. 8 years of trying, and the soon-to-be mom said, "All those years, I thought I was depressed. I wasn't depressed. I just wanted to have a baby." And that's when we had the grief discussion. It's ongoing grieving, and it's a different kind of grief, and it doesn't. The fact that you've lost this and it doesn't matter if you lose your if you miscarry. That's the other aspect. If you miscarry at 6 weeks or 8 weeks, you've lost your baby. You've lost that little life, and you will find that people can be quite insensitive and they don't understand because, well, it was only 6 weeks. But for you, that was your promise. That was your hope for the future. And it becomes very difficult to negotiate handling how people react to you. So find a way to share your grief, acknowledge that you are grieving, and it's not just depression. You don't need to be on antidepressants, although sometimes they do help. But when it comes to IVF, we have to look at the whole process of loss, of grief, and of how we get through that, so that we can get ourselves into a state where we are not surging with cortisol and all the anti-pregnancy hormones. We want to be relaxed. We want to do the acupuncture and the yoga. We want to do all of those things, but at the same time, acknowledge that there is a grieving process, and you can do grief and do life at the same time in parallel. And often I ask people to schedule grieving time so that you don't feel like you're grieving from the moment you wake up to the moment you go to sleep. So there are ways to cope, and I guess my message really is that you seek professional help. And if you're going to see a psychologist, preferably see a psychologist who works with fertility and who knows about the journey. Not everybody is equipped to help you through this in a way that you will feel heard and contained and held. So I guess that's really where I want to end off. Grief is not linear. You're going to go through ups and downs. You're going to go from one stage to the next, and it's in your best interest and in the best interest of the couple to get help from a trained IVF fertility specialist. Thank you for listening.